Welcome back, guys. In this video tutorial we will going to talk about the Helicobacter pylori infection. So let's talk about this. So Helicobacter pylori is a gram negative spiral shaped bacterium. This Helicobacter pylori infects the stomach and causes ulcer. Okay, this Helicobacter pylori is in the stomach of half of the entire population, but fortunately not all of them has symptoms. So what are the mode of transmission? Mode of transmission is fecal oral, gastric oral, oral, zoonotic and waterborne. So symptoms first thing is the itches or burning pain in the abdomen, and it become worst when the stomach is empty, nausea, bloating and loss of appetite along with unintentional weight loss. So now the main important thing that I want to talk with you, that is ulceration process of the Helicobacter pylori. How this Helicobacter pylori facilitates the ulceration process, and that is the reason why we have observing itches or pain in the abdomen when especially the stomach is empty. So the first thing is Helicobacter pylori, after entering the body, it will enter the stomach. Now I think you may ask that stomach has a very low pH, right? Or I should say the stomach has acidic environment, right? And it has a very dangerous acid for especially the microorganisms, right? Most of the microorganisms cannot survive in presence of HCl, right? So how Helicobacter pylori survives here and causes ulceration? So let's talk about. So first thing is, after entering the body, it will attach with the lining of the stomach. Okay, by attaching with the lining of the stomach, Helicobacter pylori facilitates some reaction and some steps that ultimately causes leakage of those acids from the stomach, okay, via those linings, okay, and as a result it facilitates ulceration. Okay, so now let's talk about this, how it is done. So first thing is, Helicobacter pylori's first step after entering the stomach is to ensuring its survival. Okay, so how it can ensure its survival? So Helicobacter pylori have the ability to produce an enzyme called urease. Okay, so this urease will convert all the urea present in the surrounding environment into ammonia. Okay, and remember, ammonia is a basic molecule. Okay, and as a result, due to the presence of this basic ammonia, the surrounding environment of the Helicobacter pylori becomes suitable for its survival, because this ammonia buffers the surrounding environment. Okay, that is kind of like become a neutralized environment. Okay, so now after ensuring its survival with the help of this urease, the second step of Helicobacter pylori is the formation of adhesin. Okay, this adhesin molecule will allow Helicobacter pylori to attach and to infect the epithelial cell. Okay, so first step is the secretion of the urease. This urease will ensure Helicobacter's survival by conversion of the urea into ammonia. Second step is the production of the adhesin. Okay, this allow the Helicobacter pylori to attach and to penetrate or infect the epithelial cell. The third one that I am going to talk with you is the tufted flagella. This tufted flagella allow Helicobacter pylori to penetrate the mucus layer, okay, and also help in chemotaxis. Okay, that is the third thing. Okay, so urease ensures survival, adhesion ensures attachment, tufted flagella ensures penetration. Now they will produce two main cytokines named Vacay, Kage. These Vacay and Cagay play an important role in their pathogenicity and infection. Let's see how. So Vacay itself have three main functions. First of all, Vacay bind over membrane and act as a adhesion molecule, okay, and allow bacteria to attach to the membrane. Okay, the second important thing, now once it ensures the adhesion, Vacay then also bind with the specific receptors present on the gastric mucosal cell. Okay, once bind over here, they leads to some inflammatory signals. Okay, these inflammatory signals ultimately leads to the production of inflammatory cytokines. Okay, these inflammatory cytokines facilitate some inflammation in the localized region. Again, first of all, Vacay will act as a adhesion molecule and facilitates the adhesion of the Helicobacter pylori. That is the first thing. Second, it will bind over the specific receptor on the gastric mucosal cell. Now, Vacay, number 3 is Vacay also bind with the mitochondrial membrane, okay, and facilitates the release of cytochrome C. Okay, and now this cytochrome C can facilitate apoptosis. That is the thing. So that is the three job that Vacay plays. One is adhesion by acting as adhesion molecule. Second one is creating localized inflammation. The third thing is release of the cytochrome C that facilitates apoptosis. Okay, now these things that caused by Vacay and another type of things just as tufted flagella, then we have talked about the adhesion molecules. Those things together facilitates further inflammation and ultimately that leads to leaking of the gastric HCl into the mucosa, okay, which ultimately leads to the formation of ulcer formation, and it is the reason why we observe pain sensation when the stomach is empty. Okay, so that is the entire thing from the ulceration process. So first step is the survival with the help of the urease, then adhesion with the help of adhesin molecules, then tufted flagella that help in chemotaxis and penetration of the mucus. Then 4 is Vacay. This Vacay in turn acting as a adhesion molecule. Second one is localized inflammatory reaction, and third one is release of the cytochrome C, right? Along with Cagay is also available, but their function is not too much significant. That is why we are not mentioning here it. And these 5 things together facilitates more inflammation that ultimately leads to the leakage of the gastric HCl, okay, in the mucus that causes ulcer formation, okay, and ultimately pain sensation when the stomach is empty. That is the entire concept of ulceration process. I hope now it is very clear to you. So let's talk about now the diagnosis. So main 2 important diagnosis for urease or your Helicobacter pylori infection is, one is urease test, another one is urease breath test. So what is urease test? So as you can see this picture here, we are using strips which contains spots, right, and these spots contain urea, remember it, and we will going to add the samples that we have obtained from the patient. Okay, now if the color of the spots from yellow changes to red, then make sure that your patient sample contains Helicobacter pylori. How? Because remember, if Helicobacter pylori is present, then urease enzyme will also present, because we have talked about that Helicobacter pylori have the ability to produce urease. So this urease will convert the urea in the spot into ammonia, and as a result it produces a red color. That is the UDS test. Okay, here the production of red color in the spot give you positive result, production of yellow color in the spot give you negative result. Okay, this one is the UDS breath test. In UDS breath test we are looking for biomarkers, especially for Helicobacter pylori in the breath. Okay, along with blood test available for detection of the antibody that body has developed against the Helicobacter pylori, along with stool test is available. This stool test will looking for the antigens of Helicobacter pylori, and along with also endoscopy that looks inside of the stomach and also take a portion of the stomach for further assay to diagnose Helicobacter pylori. Okay, we can also take the portion of the stomach and perform the UDS test. That could be helpful. Okay, so after diagnosis, the last one is the treatment. So it is nothing new that as it is a bacteria, we will going to use antibiotic. In addition, another thing I want to mention, that remember here the main culprit for the ulceration process is the acid. Okay, here only the Helicobacter pylori provides the way for the leakage of the acid, right? So along with antibiotic, we will also give a acid reducing proton pump inhibitor. Okay, that will reduce the acidity in the stomach. Okay, which can also give a relief to the symptoms of the ulceration. Okay, along with we can use antibiotics, amoxicillin, metronidazole, tetracycline, clarithromycin. So that is the treatment of the Helicobacter pylori. So that is the video for Helicobacter pylori. So I hope this video will be helpful. Thank you.